can your MDS genetics change over time? How frequently should a patient get genetic testing? Does it impact frequency of testing and treatment options?
So MDS genetics can definitely change over time. And again, this is what we talked about, this sort of thought of clonal evolution, meaning that as the disease sort of worsens or progresses, that new mutations can develop that maybe are driving that progression. So certainly the genetics can change over time. And if we see those changes, if this is, for example, a patient who has lower risk disease who we've just been monitoring, that might be, the impetus to kind of refer that patient for a bone marrow transplant if we're concerned that their disease is evolving to a more aggressive type of process.
How does this impact the frequency of testing and treatment options?
So there are actually, at this point in time, there is one gene called SF3B1 that is often associated with the presence of ring sideroblasts. And so right now for patients who have MDS associated with either 15% ring sideroblasts or the presence of the SF3B1 gene and 5% or more ring sideroblasts, those patients are candidates for a treatment called luspatercept to help their anemia, assuming that they have a lower risk form of MDS. So that is one situation where a gene mutation may help to identify a patient who's a candidate for a specific therapy.
How frequently?
So we tend to, every time we do a bone marrow biopsy, we tend to send this genetic testing. Usually for a patient with MDS, if we are repeating a bone marrow biopsy, it's because we are concerned about the disease progressing or worsening. And so at that time, we do find it helpful to look to see if there are new gene mutations that may reinforce the theory that a patient's disease is worsening.
Do patients need to get bone marrow biopsies?
So it really depends. For a patient with lower risk MDS whose counts are very stable, they may be able to go years without needing to have a repeat bone marrow biopsy. For a patient who is undergoing active treatment for their MDS, we'd usually be checking in with a bone marrow biopsy after a few months, 4 to 6 months generally, on therapy. And so for those patients, we may be doing bone marrow biopsies more often.